Oh boy, overstuffed. We had ours yesterday.
Hi, welcome everybody to our medical oncology Tuesday noon rounds. Today I'm delighted to have with us Dr. Katie Smith. Dr. Smith is an associate professor in exercise physiology at the University of Pennsylvania School of Medicine. Her research interests have focused on cancer throughout the spectrum, including prevention to survivorship. But today she's here to talk to us mostly about breast cancer survivorship and the type of things that our patients are needing, given that the vast majority of them these days are surviving and have consequences from the treatments that they receive from us. So thank you very much.
Hi. Thank you all for coming out to hear me talk, and thank you so much for inviting me to come and give this talk. Do you need me to directional? Here we go. Okay. All right. This is horrifying. I have to look at myself while I'm talking to you. I don't know. Do you all like looking at yourselves? Okay. Anyway, I am going to talk to you today first about the basics of an overview of the exercise programming guidelines, goals, and objectives from the recently released American College of Sports Medicine Roundtable on Exercise for Cancer Survivors. This was just published in the journal Medicine, Science, Sports, and Exercise in July 2010, and was basically an expert roundtable that came together, brought together by the American College of Sports Medicine, in light of the fact that there has been this wonderful change of improved treatment for cancer patients, creating the welcome challenge of meeting the unique needs of a growing population of cancer survivors, and that there has been, at least in the U.S., and I bet in Canada as well, a real burgeoning of programs out there that call themselves exercise programs for cancer survivors and patients, and probably nutritional programming as well, with varying quality of content. So there was a recognition of the need for some guidance from ACSM and other organizing bodies. Then I'll talk very briefly about the risk for exercise in particularly the breast cancer population, and what implications that has for the intervention setting and the collaborative care model that might need to be developed for meeting the needs of these patients, their exercise and exercise rehabilitation needs. Then I'm going to talk about the two trials that I have done in this area, as well as sort of the fact that I'm standing on some awfully broad shoulders. I had the honor of being given a tour of Vancouver yesterday by Susan Harris, and I told her that, we've been standing on her shoulders for a while, and she said, well, that explains it. I've lost a quarter inch in height over the past several years, so now we know why she's getting shorter. Many of us are standing on her shoulders. And then I'm going to talk to you for a little bit about what we learned and what we've done in the 2 years since I completed the PAL trial in formative assessment work and trying to take something that's changing the evidence base. It's a large trial, and we have some very exciting findings from the PAL trial, but how do you actually make that change clinical care and have something become standard of care? Big word, big phrase. So the lessons that we've learned working with YMCAs, and then talk about what our next steps are, and hopefully this will generate some discussion for care for your own breast cancer survivors. And I'll also state that although I'm really focusing today in my talk on breast cancer survivorship, I really see what I'm talking to you about today as a model, and that we start with working with breast cancer survivors, and then we try to move it to other tumor populations as well. So first, these objectives and goals. What are the stated goals from this American College of Sports Medicine set of guidelines? And I'm not going to do a deep review of those guidelines. That would take a lot of my talk, and they are published. I commend the paper to you. And, I'm happy to talk to anyone while I'm here or via email or on the phone about more details. But the consensus of the expert panel was that there was absolutely adequate research evidence, empirical evidence from randomized controlled trials that particularly breast cancer survivors can regain and improve physical function, aerobic capacity, strength, flexibility, body image, quality of life, and improved body composition with exercise training during and post-treatment. And we certainly know that exercise has effects on a number of physiologic systems of interest in this population because of the effects of their treatment on these very same body systems. Okay, so we also have increasing evidence from the observational literature and continuing efforts to try to build the case for a large clinical trial on the potential for exercise to reduce or delay or second primary cancers. We also have evidence that exercise can assist with preventing, treating, attenuating, or rehabilitating a number of persistent adverse effects of treatment. My work focuses primarily thus far on lymphedema as a persistent adverse effect of breast cancer. And I'll use that as kind of an exemplar of how we change clinical practice around exercise rehabilitation for cancer survivors. We also have evidence to show that certainly exercise training will improve the physiologic and psychological ability to withstand current or future cancer treatments. So there is ample evidence to show us that individuals who are regularly active and are able to be regularly active during their cancer treatment withstand those treatments better, and that those who are in better shape as they enter a second round of treatment withstand those treatments better as well. Of course, these goals, these objectives, and the reasons why you're going to prescribe an exercise program to a cancer survivor and the specific exercise prescription that would be appropriate is going to vary quite a bit across the cancer control continuum, across their experience timeline. What you're going to want and the goals of a program for someone who's just been diagnosed and is going to go through a conditioning phase with steroids prior to going through a hematologic stem cell transplant might be quite different than the objectives and goals that you would have for someone who's been out of treatment for 5 years, just to be obvious about it. In addition, the exercise prescription has to keep in mind what pre-existing health issues this person has, as well as what the persistent adverse effects are that they're experiencing at the time that they start exercising. As we think about prescribing exercise and exercise as rehabilitation in breast cancer survivors, we need to be aware of the fact that some large minority, if not majority, of breast cancer survivors experience arm and shoulder morbidity, not just lymphedema, rotator cuff issues, other soft tissue alterations as a result of radiation treatment and the surgeries, and potentially because of the interaction of radiation and chemotherapy, with newer data coming out of our institution. There is also, because of this then, the need for pre-exercise evaluation prior to starting any kind of upper body exercise. So one way of approaching this would be to say, well, just don't do upper body exercise. There's a problem with that because these individuals have problems with their upper body, and it would sort of, if you're going to say, okay, so just don't prescribe upper body exercise, I would say back to you that that would be the equivalent of saying, okay, so you've had a heart attack, you have a damaged heart, so let's just not do anything that's stressing your heart. Okay, you can see that that might be a little nonsensical. So there are some acute arm and shoulder issues that need treatment prior to starting an upper body exercise program in a number of breast cancer survivors. But there's also the need to recognize that once people have started an exercise program as breast cancer survivors, they may have changes in arm and shoulder symptoms, and there needs to be an obvious place for them to call and an obvious way for them to then be referred in for evaluation and treatment if there are changes that require that they go through some kind of evaluation and treatment for lymphedema or any other type of arm and shoulder issue. There is, as I alluded to a moment ago, tremendous value in upper body exercise for this population. There's the value of re-empowering them, literally by, quote, re-empowering them, physically re-empowering them. There is the value of regaining function, and for many women, the ability to return to work sooner and to return more fully to work. So the American College of Sports Medicine guidelines that are specific to this issue of upper body exercise in this population is that women be referred for some kind of evaluation prior to starting upper body exercise training, and that they should start that programming within a supervised setting for a number of weeks. Now, what we say in the guidelines is that the research that's been done has mostly used 8 weeks of twice-weekly supervised training sessions, but we don't know that that's the minimum required. We just know that that's what's been done and that that's been safe. Okay, it's completely possible that 4 sessions is enough. We don't know. Okay, but what we know is that what's been published and is safe is this 8 weeks, twice-weekly sessions. So based on putting all of this information together then, we can start thinking about what the right setting is for doing an exercise program and a rehabilitative exercise program in breast cancer survivors, and start to think about whether community-based intervention may be appropriate, particularly given the fact that there's likely never going to be capacity to do an in-house, in-cancer center or in-hospital rehabilitation program for every single breast cancer patient that comes through your doors, right? So there may be the need for community-based intervention after appropriate evaluation. So I'm going to talk to you about these 2 trials that I have done, and then trying to take what should be a change in the evidence base to actual changes in clinical practice. But before I talk about those 2 trials, I need to acknowledge the fact that these 2 studies are based on a number of earlier interventions and other interventions that have happened along the way while these were ongoing, that have examined the effects of upper body exercise on lymphedema and breast cancer survivors. The early work, of course, seminal work from right here in British Columbia by Susan Harris, Don McKenzie, and colleagues, where they, 22 intrepid women came to the dragon boat racing dock and said, okay, let's measure some arms and let's get in these boats. And Susan Harris told me yesterday, I worked in pediatric PT for all those years, but the paper I'm known for, I did 1 paper in lymphedema, and now I'm an expert. So this is, this is the world of lymphedema. It started quite the firestorm then and continues to. So all of these prior trials, many of which are, the first authors of which are noted at the bottom of this slide, have done upper body aerobic and or strength training exercise in breast cancer survivors and have all concluded that there is no increase in incident lymphedema or increased symptoms in women at risk for or with lymphedema after breast cancer. But these prior studies have been limited by their methodology in that they were either case series studies, which early work, that's very appropriate, but is not going to change the evidence base, or uncontrolled pre-post designs, or they were small randomized controlled trials. So there was a need to do a larger set of trials and a more systematic approach to this to hammer home the issues of the safety of upper body exercise with regard to lymphedema risk in breast cancer survivors. But based on these findings and on evidence that has been around for over 10 years that exercise actually improves lymph resorption, the hypothesis that we started with in these 2 trials is as follows: that supervised, slowly progressive, controlled increase in physiologic stress through strength training may actually be more beneficial to breast cancer survivors than the acute stress from those occasional activities of daily living that